thank you for all the wonderful video innovations that we've seen during the day. Video has really come of age with CHRODIS today, and thanks for all the very strong contributions. Time's very limited, so I would briefly say to everybody watching, you've seen the tremendous work that has gone into the policy dialogues, and there's a wealth of information and suggestions and recommendations being put in the reports for that. You've seen through the vision of the consensus statement that there are real commitments from all of the participants to take this forward and learn from it and move sustainably. And you've also seen that amongst the policy dialogues was work on the means, so looking at the funding and financing at different levels, innovative new sorts of funding, as well as well-established traditional means that we might know better, which would have taken place in Brussels with European institutional involvement, but was another one of the functions which has been done virtually because of the current syndemic situation. So there's a tremendous wealth of work there, and I hope that people will use the resources and the websites, and we can look at the statement, the summary statement that has been mentioned, that is available in 20 languages, which is full of conclusions and recommendations that I hope our panelists will be able to give us some insights in their comments about how we can take that forward. And we have just about 20 minutes or so for insights from senior decision makers, policy makers from different perspectives who've all got important commitments in the framework of CHRODIS Plus to talk about the future landscape, to talk about enablers, probably more than barriers, which we've heard realistically during the course of the day, to talk about how we can take forward financing and exchanging the good practices in these fields and really make this work sustainable and make it matter for the people who need it most. So we'll be looking at intersectoral collaboration and cooperation across sectors and all those recommendations, processes and structures, how to promote and prevent, and the new funding opportunities that are coming forward. So I'll bring in our panelists as they come. I think there are one or two technical difficulties with one or two arriving. So as I see people coming in, I'll bring them in. But I think I'm right in saying that already we have Yolanda Agra with us. Yolanda is a CHRODIS Plus governing board member, and so has been integral to the process going forward as the Deputy Assistant Director General for Quality at the Ministry of Health in Spain. And we'd like to invite you first, Yolanda, if you would, to give your insights on how you feel that this can be taken forward and become sustainable, please. You're very welcome.
Okay, thank you very much, Clive. And I will start to say that one of the main issues is to ensure sustainability of the CHRODIS Plus results, and we think that we can ensure that because in Spain we have several norms, and in fact the promotion, prevention and approach to the non-communicable diseases is included in the law of the cohesion and quality of 2003. And this regulation establishes the need to develop national strategies on those pathologies with the greatest burden for patients and health organizations. These strategies are designed, developed and evaluated in collaboration with the health regions and all the other stakeholders. And the health regions are deployed these strategies which adopt and adapt them to their real situation in order to be carried out at the local level in all the health centers. This specific strategy regarding chronicity was started in 2012 and it includes the main lines that are health promotion and prevention, continuity of care, equity and health in health, and research and innovation. The evaluation of this strategy was in 2018 and allow us to identify some priority areas and activities that were described by Ana Carriazo in the previous roundtable, so I'm not going to repeat them. We also have in place other national strategies to develop actions regarding some specific chronic pathologies like cancer, cardiovascular diseases, mental health, etc. As I said, the evaluation of these strategies in collaboration with all the stakeholders allowed the identification of priority actions for improvement. Also, I would like to mention other actions regarding the proposals contained in the consensus statement for the sustainability of the results of CHRODIS Plus beyond 2020, as the national strategy on promotion and prevention that includes promotion on healthy lifestyles, health equity, health empowerment, healthy and safe environment, and community participants and action. Also, it was mentioned before, the national network of health schools for citizens, oriented to increase the empowerment and involvement of patients and their caregivers through information and training tools based on the best available evidence. And also the strategy on primary care was approved in 2019 in order to increase the quality of the primary care in our national health system and its capacity of resolution and continuity of care. Also, annually, we call to collect and select best clinical practices on non-communicable diseases to share among the different professionals and health administrators. So we think that with all these actions, we can sustain all the proposals included in CHRODIS Plus. Also, for us, it's very important for this sustainability, and also it was mentioned before, to have specific funding to prevent and tackle chronic diseases. In that way, the Ministry of Health annually provides the health regions with a specific budget to implement projects related with chronic diseases, especially for rare diseases and neurodegenerative diseases. Also, an agreement was established between the Ministry of Health and the Spanish Federation of Municipalities to empower the Spanish network of health cities and implement the health promotion and prevention strategy at local level. Recently, the Ministry of Health sent an application to the Structural Reform Support Program of the European Commission to ask for technical support to analyze the models of organization in primary care and establish recommendations according to the new needs of for primary care in our national health system. Also, the Ministry of Health is participating in several joint actions. I want to mention that we are participating as co-coordinators with Carlos III Institute in the joint action of national contact points, and also other actions that are developed in Spain as the implementation of digitally enabled integrated person-centered care and mental health. Regarding the Recovery and Resiliency Fund that was mentioned before in the previous roundtable, the Ministry of Health has included a request for a budget to implement the strategy for addressing chronicity and for development of comprehensive care model for multimorbidity in different regions. And finally, regarding the European Social Funds European Social Fund Plus, the Ministry of Health has been working with the health regions to select priority actions, among which are the promotion and prevention of non-communicable diseases. So in summary, we think that the Spanish Ministry of Health is ready and willing to ensure sustainability of CHRODIS Plus results in collaboration with the health regions and the other stakeholders. And also the Spanish Ministry of Health is working on increasing the funding to promote, prevent, and manage chronic diseases. So thank you very much. And also I would like to take the opportunity to congratulate all of you for this excellent work. Thank you very much.
Yolanda, thank you very much indeed. Thank you for your very good timing and your very powerful contribution there and important messages. I think that will be well heard how the ministry in Spain is ready and willing to build the sustainability. And I think you made a lot of important points around your work with region-specific funding approaches and networking, whether it's professional sectors or whether with patients, for example, and working in mental health and other sectors. So thank you very much for kicking this off. Let's go to the other side of the European Union now, if we might, and come to Poland. And we're delighted to have with us today Małgorzata Majewska. I hope that's a good enough pronunciation, Małgorzata. And you were participation in the National Policy Dialogue, and you're head of unit coordination and programming for the EU at the Department of Investment at the Ministry of Health in Poland. So very well placed to be able to give us your valuable insights on these questions around sustainability. You're welcome.
Good morning. Welcome, everyone. First of all, I would like to thank you for opportunity to participate in this event. I have some other perspective as working with mostly European funds this year with CHRODIS Plus, but in my opinion, the current financial perspective of EU funds, the ending of the third health program, and the end of CHRODIS Plus initiatives showed how important cooperation in the field of preventing measures is. In Poland, also cardiovascular diseases and cancer diseases are very important issue, as in all Europe. Cooperation between EU countries in developing good practices is crucial, as it was said in the statement. And I think that now we are in very important moment because we have the opportunity to draw conclusions from the implementation of tasks in the field of health promotion in recent years. In particular, conclusions can be made from different EU projects and initiatives. In designing policy and giving sustainability for CHRODIS proposal, I think that it is, first of all, in countries' policy, important to clearly define the goals and a method of achieving them. But it is equally important to, in the context of new perspective of EU funds and new EU for Health program, to ensure a clear communication strategy of funding options. It is another dimension that I think gives high sustainability for CHRODIS proposals. Projects and initiatives concerning prevention and health promotion can be financed from many different sources. In the case of Poland, this is Ministry of Health, health funds, local funds, and last but not least, EU funds. Polish entities also participate in various EU initiatives, and this gives a really nice and fruitful opportunity for central authorities, large medical entities, local governments, and local communities to help them design policy at their level. What I would like to mention more is that funding activities from different sources is a desirable condition, and it is necessary to provide a variety of intervention of a different nature, from local initiatives where close access to the patient is required, to nationwide activities that ensure access to appropriate tests, therapies, or equipment. And it is, I would like to emphasize the need of an appropriate flow of information about the possibilities of financing and participation in international initiatives. The clear information should be available on all levels, starting from the European Commission concerning EU for Health program, and institution providing support from European Social Fund, for example. In Poland, I can give some example that a repository of possible preventive measures for selected diseases is being created within the framework of European funds. There is an internet search engine which allows people from different levels and different policymakers to find some key solutions or good practices. And I think that also exchange of good practices is crucial, and I think that this initiative of CHRODIS Plus and is really important because at all levels of policy making, all stakeholders have information about the good practices. I think that because time limit, it is what I wanted to mention as the key is this clear communication strategy. Thank you very much.
Thank you very much indeed, Małgorzata. It's much appreciated. I think, again, in the short amount of time that you have available, there are a lot of important points which I think we can follow up and take forward. It's very interesting to hear about your repository of measures for policymakers and stakeholders that can be searched, the importance of prioritization, the role of municipalities, and obviously all linking through, very much chiming with the recommendations from the policy dialogue on accessing funding points. So thank you very much for making those points so clearly. Now I'll go, if I may, now to the northern part of the European continent. I can see a fantastic background showing us the Northern Lights, which we've had wonderful video backgrounds. So I saw the pyramids in the last section and now the Northern Lights. We really are having an inspiring treat today. So Elisabeth Detia, you're very welcome. Elisabeth Detia, I hope that's a good pronunciation, is Director General for the Directorate of Health for Health in Iceland, and you are very welcome, and we will very much welcome your particular insights and perspectives on this subject.
Thank you. Greetings from Reykjavik. Can you hear me?
Yes.
Yes, perfect. It's a pleasure to be with you here and joining you here at this final session today. Yeah, like you said, my name is Austin Bigman. I'm a Director General at the Ministry of Health in Iceland and in the Department of Public Health. I'm a member of the governing board in CHRODIS Plus, but I'm sorry to say that I'm a silent partner, but as the Directorate of Health in Iceland has been the active partner. But I wanted to begin by addressing how to increase the overall funding to prevent and tackle chronic diseases. And first of all, I wanted to mention cooperation. In the background document for this roundtable, the EU level policy dialogue report from a meeting that was held in June this year, member states suggest ways to increase funding and investment in health promotion and prevention of NCDs. And like we all know, first and foremost, it's the responsibility of national and regional governments who must set these priorities and dedicate adequate funding and public budgets to the priorities. But then, as we all know, that public budgets, they are limited. But there are some interesting solutions presented in the report, and one of which caught my eye. It was using joint budgeting across ministries to finance work addressing these common objectives. And this is a fresh, I think, and a fascinating idea, and seeing it on a print, especially concerning a system that is very, the financial system that is very much built on traditional elements, where the Ministry of Finance works with financial instruments and their priority settings, like traditionally rarely reaches the Ministry of Health. But in Iceland, we recently, like 4 years ago, we had a change in our act or law, if you prefer, on the public finances, and where we are actually changing this, but this takes time. And it would also be interesting to see if this is just happening in Iceland or also in the other countries, because we are with this, the government is trying to better align priorities with the budget. So this is a new thing that we, or maybe you can't say it's a new thing, but it has been going for the on for the last 4 years. But time, changes take time, as we all know. I also wanted to mention like the role and the capacities of the national focal points in this matter. I think the national focal points also have a role to play, as they know that public budgets are limited, but we have to invest in the right activities and interventions, and we have limited funds, but we have to be and because of that, we have to be very selective. And we have to be clever when we choose interventions. And I think national focal points, they can be a very important influencers on the interventions and that are being selected at local level, and can also share, the successful local activities with a national audience. So national focal points have a great role, I think, in ensuring that evidence-based results of implementations are like effectively communicated to policy makers and other key stakeholders. In this regard, I also wanted to mention like the developing processes or structures. This report that I mentioned before, the EU level policy dialogue report, it also mentioned building awareness and of funding and financial opportunities, and to think more like broadly about the tools at our disposals, and like alternative fundings and financial mechanism. And coming from a small country, and also an EFTA country, and not being one of the EU countries, I can also relate to the existing barriers to access. For example, the EU funds for health promotion, as well as international funds for health promotion. Even though there are many funding possibilities out there, navigating is complicated. Navigating this. And many funding possibilities are not necessarily within immediate reach. So there can be a limited access. And therefore, I welcome the DG Sante is planning to launch a joint action of her that would help pool all the information related to funding opportunities for health. And this could also increase like the role and capacity, I think, of the national focal points in health, and also improve cooperation across these sectors. Dr. Needle, you have to stop me if I'm going over time.
Okay, one more minute, I think, please.
Okay. And then, about the cooperation, I just wanted to mention, I think that the future, also for the future for the is bright. I think that linking CHRODIS to other projects or international instruments like the United 2030, the Agenda for Sustainable Development, like the SDGs, like we've done in Iceland. I think that would also ensure the sustainability of the CHRODIS Plus results for the future, and also integrating it into national policies. It's also important, and this is a key to its, I would say, sustainability. And I see that we all play a role in this success. So thank you.
Thank you very much indeed. I very much appreciate that. And you made an important point. I was going to ask you if you hadn't already raised it about the SDGs, because I know that was the subject of the Icelandic National Policy Dialogue. But that is perhaps one thing that we will come back to. We've had a couple of questions coming in through the panel that I will bring in as well in a few moments about the current situation in particular. But I've been trying to understand if we have the European Commission with us, because I see that Stefan is having difficulties in connecting, and I now see his name. So I'm looking for some advice. Can you hear us, Stefan? Are you there and able to join us? I think there are some technical difficulties. So I wonder, we've had a question from the audience. So from our three existing panelists, while we're still trying very much to get Stefan, because obviously some of the points you've been making would be interesting to get his perspective too. For example, the national focal points, where I understand there will be a joint action of some sort that is coming soon, but I'm not the best source of advice on that. But we've had a question from Frank Lemon from Germany about how the current pandemic, this endemic pandemic of COVID-19 at the moment, is changing perspectives. And obviously that has come at a particular stage during the CHRODIS preparations. And many of the policy dialogues were carried out before. And I'd be interested if you kind of thought, there was a comment earlier during the day about how I think Iñaki said that it was a recommendation that you should carefully evaluate the optimal moment to take forward your recommendations. So just one or two of you have alluded to this perhaps being a new paradigm, a new changed moment. Is that how you see things? Yolanda, perhaps if I can come back to you talking about your particular initiatives, would you see this gives a new impetus for actually taking forward these outcomes on chronic diseases?
Excuse me, are you referring in this pandemic time?
Yes.
What's the question?
Yes, in the context now of things having changed so significantly with COVID, do you foresee that could provide that optimal moment to actually make the significant changes that are needed?
Oh yeah, it changed a lot. The healthcare changed a lot because you know that the pandemic hit very hard in our country. So the first level, that is the primary care level, that used to be very strong in our country, is absolutely in very bad damage, because they have to do a lot of public health test for patients. And also one of the problems for the patients with chronic diseases in this pandemic time is that they didn't want to go to the health centers or to the hospitals because they were afraid. And that, as a consequence, some of them had a very hard adverse events because they didn't go in time. Another thing is that, for instance, where we are talking now with oncologists or other specialists, we see that, for instance, patients with cancer, they were not diagnosed on time, or they didn't receive the treatment, or some of the patients, they didn't have the surgical procedure on time, with all of these consequences. So we are now again in this second wave. That is the first thing is that most of the units of the beds in the intensive care units are occupied by COVID patients, and that is not good. And also we have a very high rate of occupancy in the hospitals for COVID patients. So again, some surgery procedures are stopped or delayed. And so that means that we have to change all of this. And we know that our professionals are working with the patients on the phone, on using the telemedicine, on other tools that we also are working with a group of experts regarding the impact of all of these tools. So obviously it's changed, and we are trying to find solutions, in this way.
Very good, thank you. That's very constructive. Marcus Harter, maybe I can ask you the same question. Obviously, your insights are pending. We're in the middle of the pandemic still, but are you seeing that there are changes towards potential approaches towards the chronic disease management in your country?
I think that it is the same as in Poland as in Spain. We see that some procedures are delayed. The COVID is the most important issue and the biggest problem. We also try to telemedicine and new procedures made by telemedicine, but of course it's not a solution for all the diseases and for all consultations. So I think that some programming is being delayed to 2021, but of course we try to think how to start the new policy or new programs in 2021 after the COVID, and how to encourage people to come back to prophylactic, to coming to doctors, think about their health, not only about the COVID.
Thank you. And Astildir, from your perspective, is this going to mean radical changes, or do you foresee that you've already made your preparations?
Yeah, we are in the third wave here in Iceland right now of COVID, and I think that we see that in the light of the COVID pandemic, that the impact and the risk related to underlying health conditions and its effect on the morbidity and mortality rates. And people here have been somehow reluctant to seek services within, people with NCDs. But of course, we've seen, like Marl Corsata said, increase in the use of telemedicine. So we've seen some developments in telemedicine that maybe faster than we would have seen if we wouldn't have COVID. We wouldn't have had COVID. So we've seen a change in the health services in Iceland and how we provide services. So yeah, I see we're having some more questions, or
yeah, there will be. I'm seeing messages in the side panel. Unfortunately, Stefan cannot join us from the European Commission in Luxembourg. There are communication difficulties. He has been trying frantically. So I'm sorry for our fellow panelists and audience, because obviously a lot of the points that you have been making would be very useful to engage with the European Commission. But I'm sure that these will be taken forward, and we'll be able to follow up in numerous ways on this. I'd very much wanted and been asked by the organisers to make sure that we end on a positive vibe. And obviously there are huge numbers of negative associations with the current situation. But I've been hearing a lot of positivity during the course of the day. I've heard in discussions people thinking about going forward about what are the key enablers, and obviously there have been some discussions about barriers as well, so we won't overlook those. But I wonder if I can ask you to focus on what you would see would be the key enablers for future sustainable progress going forward. You might want to talk a little bit, as we've heard from Iceland, about the SDGs. So they are an important factor that would happen. Many of you have raised working with different stakeholders, new approaches, digital transformation has come into it. The recommendations include Green Deal, green transition, using new economic governance measures in the European semester, or the joint budgeting we've just heard. So one of my questions is to conclude, if I can give you each an opportunity to say what you think positively going forward could be the enablers to take it forward, and perhaps an opportunity for you also to say, what can we all do to help you? What do you need most? I suspect lots of the time people are coming to you asking you to do impossible tasks, and it's quite clear that that's been happening throughout this progress, with people under enormous pressures to deliver at this time. But what do you need, public, patients, policymakers, to do, apart from give you lots of money? I'm going to rule out that as a suggestion. Let's take it that we'll give you some money. But apart from that, what sort of help and support would you need to realise the vision in the consensus statement on chronic diseases? Perhaps we can start from the other way around. Perhaps I can come to Iceland first, and then Poland and Spain, if I may. So perhaps I could come to Astildir first, if I might, if you're able to say what would work for you.
Yeah, a complex question. I don't think I have a simple answer to that. But I'll try. actually, you mentioned a lot of interesting things that would need some more looking into, and would if we would have the whole day, we could talk about a lot of different aspects of this. But I think that we are seeing like even we were talking about COVID before, but health it is an increasing priority, and at all levels, and I think new times bring new opportunities, but also they need to move to more you need more communication and coordination across all sectors and all levels. I think that priority setting in health is more important than ever. I think also engaging like in work across policy areas, and really also in to encourage local initiative practices. How can we improve that, or nurture that, and I think we need to focus more on the systematic like upstream changes, that rather than downstream projects. I would love to have endless source of funding for that.
Yeah.
But like you said, we have a lot of challenges. Like we know that public health and health promotion, the services have been underfunded in many years, and like someone mentioned the number, we only have like usually 3% of the national budget, being spent on prevention, and we have, in contrast, we have also heard the number 60% of the budget being spent on, curative and rehabilitation care services. So I would like to have more focus on the, upstream changes. I think that I think we have all seen that that there is an added value of the cross-country also collaboration like that we have here in the CHRODIS project, and that so I think we have many aspects that we could discuss on this issue. So
hopefully we'll have more opportunities that come in the future, but thank you very much. I realize it's a complex question. Thank you for your insights. They're very valuable. If I can come to Poland, Małgorzata, if I may, please, from Poland.
Yes, of course. I think that what I said in my statement, that communication is the key, because in Poland there is so many actors, so many levels of policy making in the field of health, that the communication and good coordination is the key. As I said, such initiatives like CHRODIS Plus, which gives us some opportunity to find out who in different country did something and it went well, is really crucial, because it's sometimes spend us time when we want to think about some new aspects, new ideas that someone has already made it, and it has some good results. So I think that this communication between different sectors, different levels, and coordination is very important. Thank you.
Thank you. That was very clear. And last but not least, if I can come back to you, please, Yolanda.
Okay. In this specific time, the main thing is to find an effective solution for the pandemic, to come back to treat the patient as we do before. But regarding this situation, we need kind of reorganization of the public health, and we will need more resources regarding that. And also, I think we will need to empower more patients in a way that they could participate better in their own process of health. and also to increase the communication with patients, so among different levels of professionals, among primary care of hospital, it will be a more efficient way to work. I'm referring with all of that to improve telemedicine and digitalization and all of the techniques that are there, and we have to follow the way to improve this, because it's the future, and we need that during this pandemic, and also to respond to the chronic patients that are waiting for a better care in this situation. And also we need the funds from the European Commission, and we hope we can have them to better improve our health system. Thank you.
Well, thank you very much. And thank you to all three of you and to Iñaki and colleagues who presented in those excellent video and presentations at the start to set the scene. I'm sorry that the technology has defeated us on this occasion and we can't connect with Stefan. Obviously, the role of the European Commission in initiating and working with you all as partners throughout this has been fundamentally important, and we are all waiting on the current negotiations on the future EU for Health programme, the recovery funds and the multi-annual financial framework at the moment to find out how we can all take forward many of those things you've been saying. But I think you've raised a lot of important issues. I'm here on behalf of EuroHealthNet today and bring greetings from our director, Caroline Costongs. I'd just like to say thanks to all the partners. It's been enormously valuable, and I've heard things throughout the day where on resources, on guidance, on portals, on taking forward and sharing, disseminating best practice, we will want to play our part ahead in helping the lessons are learned, implemented, developed sustainably. And we look forward to being able to take up many of the important issues that you've been raising with you in context to help your citizens and public on the ground where this has most effect. But thanks also to the organisers for inviting me, and to my colleagues in our EuroHealthNet Brussels office for doing all the hard work behind me to make this happen. And I'll hand back to Zoltan with that and wish you